Hello, everybody, and welcome to our webcast today, sponsored by the U.S. Agency for Healthcare Research and Quality, where we will be featuring several new CAHPS tools for patient experience measurement. My name is Dale Schaller. I'm the principal of Schaller Consulting Group. I'm a longtime member of the National CAHPS Consortium, and I've got the privilege of serving today as your moderator. Next slide. Just a few housekeeping details before we get started. First of all, if you have any issues with sound coming from your computer, you can always try to connect to the webcast audio using your phone by selecting the Call Me option, entering your phone number, and then you will receive a call from Teams, or you can click on the phone call to find the dial-in number and the meeting ID and join that way by audio. If your computer happens to freeze up during the session, you can always try to log out and log back in. And most importantly, at any time during today's webcast, you can ask a question using the Q&A icon that's shown on the screen. You simply type in your question, you click on the Ask button, and your question will be submitted. We encourage you to let us know your name and your organization so we can sort of sense where you're coming from. We'll do our best to answer your questions at the end of the webcast today. Please note also that the raise hand feature and the chat functions on the Teams platform are disabled. One other thing to note is that there will be a replay of the webcast as well as the slides at some point in the near future on the CAHPS website. Next slide. So our agenda today will begin with a brief welcome from the Agency for Healthcare Research and Quality, or AHRQ, followed by an overview of the CAHPS program. We'll then introduce two new surveys that are currently in development and two new CAHPS surveys that are now currently available. We'll conclude with a review of CAHPS resources and tools for supporting patient experience measurement and improvement, and again, answer as many questions as we can get to that you submit along the way. Next slide. So I'd like to introduce now our speakers for today, beginning with Aruna Jhasti, who is a health science administrator at AHRQ. And Aruna does help oversee the CAHPS program on behalf of the agency. Aruna will be followed by Stehpanie Fry, who is Associate Vice President at Westat, and then Julie Brown, who directs the Survey Market Development Group at RAND. Stehpanie is the lead staff support on the CAHPS instrument team, and Julie has been a key member of the CAHPS instrument team since the inception of the program back in 1995. And so with that, welcome to our speakers, welcome to all of you, and I'll turn it over to you now, Aruna.
Thank you, Dale. Welcome, everyone. Thank you for joining today's webinar. Today, I'll provide a brief overview of the Agency for Healthcare Research and Quality and share some background information on the CAHPS program. CAHPS stands for Consumer Assessment of Healthcare Providers and Systems. So today, for new users, we want to provide an introduction to the CAHPS program. And for all users, the webinar will highlight new and upcoming CAHPS surveys, along with key resources to support survey administration, analysis, and improvement efforts. Next slide, please. AHRQ is a research-based agency within the U.S. Department of Health and Human Services. It is the lead federal agency responsible for improving the safety and quality of the U.S. healthcare system. AHRQ generates research, tools, and data using best practices that healthcare providers and policymakers use to evaluate and improve the quality of care delivered to patients. As a research agency, AHRQ does not mandate the use of the surveys or submit the survey results to us, but we do encourage the use of our tools and products to drive improvement. Next slide, please. Our CAHPS program has been around for 30 years and has advanced the science of measuring and improving patient experience. This includes validated surveys for high-stake purposes, supplemental questions including narrative items, quality improvement resources, databases for selected CAHPS surveys, research to advance the science of patient experience, measurement, and improvement. We have deep expertise in measuring and improving patient experience, and we provide support to various activities of the CAHPS survey users. All the tools and resources are available in the public domain for use. Next slide, please. So what is patient experience? Patient experience refers to what actually happens to a patient in a healthcare setting or with a health plan, or how often something happened. It includes a range of interactions that patients have with the healthcare system, and this slide shows some of the elements of patient experience that are measured by CAHPS surveys. These are domains that are important to patients, and they are regularly updated to reflect changes in the healthcare delivery process. It is important to note that patient experience is different from patient satisfaction, which measures how patients feel about their healthcare and whether their expectations were met, while CAHPS surveys capture what actually happened during their healthcare experience. Next slide, please. CAHPS surveys are considered as the gold standard for patient experience measurement because they capture the patient's voice. CAHPS surveys reflect what patients told us is important to measure and report. We use a standardized methodology and research findings to develop valid and reliable surveys. The survey items are extensively tested with patients to make sure they're relevant, clear, and easy to understand. Next slide, please. And now I'll turn this over to Stehpanie Fry to provide an overview of the CAHPS principles and approach.
Thanks for getting us oriented, Aruna. I'm going to take the next few moments to provide an overview of CAHPS principles and the customizable CAHPS approach to patient experience measurement. Next slide, please. CAHPS surveys, as well as the documentation for users about survey administration and reporting, are developed using research evidence. CAHPS surveys are designed to focus on what patients think is important about healthcare delivery, what they need to know as consumers of the healthcare. To ensure CAHPS surveys do indeed reflect the patient focus, there's a standardized development process that includes conducting focus groups with patients, getting input on survey domains and questions, cognitively testing drafts of surveys with patients, and ensuring that patients and consumers are involved in the development at each step. Stakeholders and user input are incorporated at the initial development stage, but also on an ongoing basis thereafter, as the CAHPS consortium revises surveys as needed to stay in sync with the changing landscape of healthcare delivery. For example, we leverage stakeholder technical expert panels, solicit input through public comments, collect feedback after surveys are released, and regularly collaborate with partners to test new content and methodologies. The CAHPS consortium conducts ongoing research into best practices to support all aspects of sampling, data collection, administration methods, analysis, and reporting about patient experience of care. Prior to releasing any survey, there's extensive field testing. Field test results are analyzed to assess the representativeness and reliability of the data. Testing is often conducted iteratively with multiple rounds to ensure that changes are achieving the intended effect. Documentation available to support CAHPS survey users highlights the importance of standardization. Collecting, analyzing, and reporting data in a standardized fashion allows for data to be compared over time. For example, if you want to know how your scores may have changed over the previous years. It also allows for comparison across entities, whether that be practices, plans, or regions, for example. We have mentioned it before, Aruna noted, but bears repeating that all CAHPS surveys and tools and resources are in the public domain and available for use free of charge. Next slide, please. Based on the CAHPS principles, there are a suite of surveys looking at different aspects of patient experience with healthcare. This slide shows some examples of CAHPS surveys. Some surveys ask about patient experiences with providers, such as medical groups, practices, or surgical centers. Other surveys ask about patients' experiences with care delivered in specific types of facilities, could be hospitals, dialysis centers, or nursing homes. There are CAHPS surveys that ask enrollees about their experiences with health plans and related health plan programs. Finally, there are surveys that ask patients about their experience with care for a specific health condition. Next slide, please. If you're fielding a survey that you're going to call a CAHPS survey, you'll begin with a CAHPS core questionnaire. To the core questionnaire, you may add additional or supplemental items. This approach allows you to create a customized CAHPS survey to collect data that's both comparable across entities, but also allows you to include topics that are important to you and that specifically meet your needs or the needs of your population. CAHPS supplemental items are available to users and offered in a searchable format, either by CAHPS survey or by topic area. Users may also opt to add their own internally developed, or what we call homegrown, items to CAHPS surveys. Next slide, please. Here are some examples of CAHPS supplemental items. There are many CAHPS developed supplemental items, and we call them sets or groups by topic area, and they address the common areas of interest across many users, things like shared decision-making, health literacy, use and effectiveness of health information technology, supplemental communication items that may be designed for taking an in-depth look at performance or to support quality improvement efforts, narrative items or open-ended feedback from respondents, and many others. If there are no CAHPS questions covering the topic of particular interest to you, as I mentioned, you can add your own user-specific questions, and these we provide instructions and you put those at the end of your CAHPS survey, but there are many different ways that we can ensure that the CAHPS survey meets your specific needs. Next slide, and I'll turn it over to Julie Brown.
Thank you, Stephanie. Hello, everyone. I'm here to talk with you about two survey development activities, a survey on maternal health care and an update to the health plan survey. Next slide, please. The maternal health care survey is being developed by the Yale CAHPS team and asks about patient experience with hospital-based birthing care, focusing on care received during labor and delivery. The survey is modeled on AHRQ and is administered after discharge to adult patients whose hospital stay had a primary diagnosis of labor and delivery. Next slide, please. Let's talk about the survey development for this process for this survey. The survey has followed the traditional development steps of any CAHPS survey and began with a review of the literature, followed by extensive input from patients. This included formative interviews and focus groups with English and Spanish preferred patients to inform every aspect of the survey, such as the topics that are important to patients in assessing the quality of care during childbirth, what makes for a positive or negative experience during childbirth, and what survey modes would be easier for a new parent to respond to. Patients participated in an expert panel to give further input along with other stakeholders on the survey content, what types of facilities should be included, and how to administer the survey. Draft versions of the survey were tested in multiple rounds, with English and Spanish preferring patients via one-on-one cognitive interviews. Similarly, other stakeholders, which includes clinicians and others who provide care or support before, during, and after childbirth, participated in formative interviews, the same expert panel as patients, and have provided feedback on draft content and other aspects of the survey. Currently, the team is preparing for field testing, a critical step to finalize the survey for public release. Multiple hospitals in the U.S. will soon begin to administer English and Spanish language surveys using a web mail protocol. Let's take a look at the topics included in the field test survey. Next slide, please. CAHPS field tests always include more items than will appear in the final survey, so that the team can identify the final set of items that capture experiences important to patients and provide reliable measures of experience across hospitals. As you can see, communication is an important topic within this survey, along with care from doulas, coordination of care within the hospital, how responsive hospital staff are to patient needs, care received during interactions with doctors, nurses, and other hospital staff, communication about pain, support for breastfeeding, cleanliness and restfulness of the hospital, discharge information, the CAHPS 0 to 10 rating of the hospital, and whether the patient would recommend the hospital. AHRQ will share updates as development of this survey continues. So please watch for more information here as well as the CAHPS website. Next slide, please. As I noted earlier, another survey development activity is an update to the health plan survey. The current health plan survey is version 5.1, which was released in October 2020. As a reminder, the health plan survey asks plan enrollees about their experiences with ambulatory care. The survey is administered to adults who report on their own care, and there is a child survey administered to a parent or caregiver of a child about the child's care. Health plan survey measures include access, communication, health plan customer service, and multiple 0 to 10 ratings, including healthcare, doctor, specialist, and health plan. The survey can be administered by web, mail, or phone. Next slide. The development of the Health Plan Survey 6.0 is in progress. The CAHPS Consortium's efforts to update the survey are informed by feedback on survey content and priorities we collected from patients, providers, survey sponsors, and other stakeholders during an expert panel. Our current focus is on the adult survey, and the goal for the 6.0 survey is to have a shorter survey than the current 39-item core 5.1 survey version. The revised survey will include new content for health plan supplemental items that focus on health plan roles and functions. Let's review the development activities for that survey. Next slide, please. Patient engagement has informed this effort and includes direct feedback from patients who participated in an expert panel to comment on health plan survey topics, gaps in the current health plan survey, and to share their thoughts on the most important or priority topics to include to assess health plan. As survey development progresses, patients will provide feedback on new and revised survey content via cognitive interviews that will be conducted with English and Spanish preferring patients. Key stakeholders, including survey sponsors, participated in the same expert panel as patients, and their feedback and priorities also inform our work. Stakeholders will continue to provide feedback on draft survey content as these activities progress. As with all CAHPS surveys, a field test will be conducted. The design of that field test is pending, but the survey will be field tested in both English and Spanish using multiple modes of administration. Thank you for your time today, and I'm handing it back to you, Stephanie, to go over new surveys.
Thank you, Julie. So Julie gave you a bit of a preview of what's coming soon, and I want to take the next few minutes to talk a little bit about what has recently arrived. Next slide, please. The first of two surveys I want to talk about is the CAHPS Outpatient Mental Health Care Survey. It was released in 2024 and asks adult patients about experiences with mental health and substance use disorder services received in any type of outpatient setting. The CAHPS research team developed this instrument in response to changes in the way that services are provided, and also as a replacement for the CAHPS Experience of Care and Health Outcomes, or ECHO, survey, As some of you may know, ECHO is a health plan-based survey that asks plan enrollees about behavioral health care. It was developed some time back, and the new survey is designed to offer an update and a little bit more flexibility in terms of the structure of the care delivery, not just through a health plan. The new outpatient mental health survey is administered to adults who received mental health care or substance use disorder services in the previous 6 months, including services that may have been received in person or by phone or video, knowing that these are much more common, particularly since 2020. Potential users of this survey include mental health providers, medical groups, hospitals, health systems, health plans, healthcare monitoring organizations, and state agencies. Next slide, please. The outpatient mental health survey focuses on experiences with treatment and counseling services, including getting help between appointments and potential barriers to care. The survey results can be used to assess patient experience and identify strengths, as well as areas in need of improvement. The survey produces several measures of patient experience, including getting appointments for prescription medicines, getting mental health counseling, communication with counselors, goal setting, getting help between appointments, ratings of mental health counselors, unmet needs, and financial barriers. I'll also note that the CAHPS offers supplemental items about mental health care that can be incorporated into the CAHPS health plan or the CAHPS clinician and group surveys. Next slide, please. AHRQ hosted a webinar last October introducing the outpatient mental health care survey. And I want to just flag that you can watch a replay of this. It's available on the AHRQ CAHPS website if you're interested in watching that. Next slide, please. Pivoting to our next survey, I want to introduce you to the CAHPS End-of-Life Care Survey that was also finalized in 2024. The End-of-Life Care Survey assesses healthcare experiences in the last month of life. This could include care experiences across a range of care providers and settings, such as at a doctor's office or clinic, in a hospital or emergency room, in a hospice facility, at home, in a living assisted facility or nursing home. It also includes care that may have been received by phone or video call. Respondents are informal caregivers of adults who received end-of-life health care. The survey is designed for use by health systems, accountable care organizations, Medicare Advantage plans, or other organizations responsible for providing or paying for end-of-life health care. Next slide, please. With 37 questions, the survey produces experience of care measures reflecting timeliness, communication, respect and honoring the preferences of patients, support for symptom management, emotional support, and an overall rating of care received. The survey also includes one open-ended question to capture narrative feedback about what went well or could have gone differently. Again, I invite you to visit the AHRQ CAHPS website to learn more about the end-of-life survey. We do also have an upcoming webinar about this survey expected later this summer, so please keep your eyes peeled for more details on that. Next slide, please. Before we move to our Q&A portion of the call, I want to take a few minutes to share some information about the tools available to support CAHPS survey users. Next slide. In addition to offering the broad suite of surveys I noted earlier, AHRQ also offers a wealth of resource materials to support users. There's documentation to help you plan your data collection approach, draw your sample, prepare your surveys for paper, telephone, or web-based administration. There's information about receipting data and calculating response rates, and lots of information about best practices to help you maximize the value of your data collection. I will note that while AHRQ develops CAHPS surveys and guidance materials, AHRQ does not mandate the national implementation of any of the surveys. As you'll see noted, it might be small font depending on the size of your screen, but at the bottom left, some CAHPS surveys are administered by CMS, And in those circumstances, I would encourage you to consult CMS guidance about specific parameters for administration. Next slide, please. AHRQ provides a range of tools to help with analysis. The goal of analysis is to prepare for reporting. All CAHPS surveys include composite measures, which are groups of questions that together assess patient experience in a particular area. For example, communication with a healthcare provider. Through analysis, you combine the data for each of the individual questions and calculate a composite score. Typically, individual survey items are less reliable than multiple item combinations. If you're looking to compare your results to the results of others during the analytic phase, it's also important to conduct case mix adjustment. Case mix adjusts for characteristics about survey respondents like age, education, and health status. Conducting case mix adjustment makes it more likely that any differences you may see in reported outcome are the result of actual differences in patient experiences versus differences in the types of patients that may be seeking care from a particular facility or from a particular set of healthcare providers. Case mix adjustment is a way to sort of level the playing field in doing the comparison and analysis. To help with these analyses, the CAHPS Consortium makes available a macro to support composite measure calculation and case mix adjustment. There's a SAS macro along with user support documentation available, again, free of charge on the CAHPS website. I'll also note that there's an R version of the macro that's available from CMS. Next slide, please. In addition to providing documentation about surveys, administration, and analysis, AHRQ also supports users with research and resources to improve healthcare. The CAHPS Ambulatory Care Improvement Guide is one such tool. The Improvement Guide is a comprehensive resource for health plans, medical groups, and other providers who are seeking to improve their performance in the domains of patient experience that are measured by CAHPS surveys. The guide is designed to help organizations cultivate an environment that encourages and sustains improvement in patient-centered care, analyze the results of CAHPS surveys and other forms of patient feedback to identify strengths and weaknesses, and develop strategies for performance improvement. I'm excited to announce that the Improvement Guide is in the process of being updated, and I would encourage you to check back on the CAHPS website regularly over the coming months for revised, tailored segments to support users. So little individual segments rather than everything all in one place. It makes it bite-sized and a little easier to observe. Next slide, please. The CAHPS databases are AHRQ's repository for data from selected CAHPS surveys. The primary purpose of the CAHPS database is to facilitate comparison of CAHPS survey results by survey users. AHRQ currently has 4 CAHPS survey databases, one for health plan, child hospital, home and community-based services, and there's also a database for the CAHPS clinician and group survey, though I will note that it was operational only from 2010 through 2020, so there are no data from the last 5 years for clinician and group. If you are collecting data for health plan, child hospital, or HCBS, I would encourage you to consider submitting your data to the database. I have the 2025 submission dates here up on the screen, and you can anticipate for 2026 about the same timeline if you're considering submission. Next slide, please. The CAHPS database has a range of products to support users, both those who submit data as well as those who may not. Users who choose to submit to the CAHPS database receive private feedback reports showing their survey results alongside averages for other de-identified submitters. We also prepare annual chart books with summary level results representing all of those who submitted, and these are available to the general public, not just to people who participate or submit to the database. On the AHRQ Data Tools portal, there's access to CAHPS data that you can view or download. And finally, de-identified data are also available to support a wide range of research Anybody who is interested in that can seek out a data request form that's available on the CAHPS website. Next slide, please. A plug for a final few CAHPS resources. The CAHPS website includes a bibliography of nearly 600 publications about the development and use of CAHPS surveys. There are links to articles there and abstracts that you may find useful. On the website, you'll also find a searchable set of frequently asked questions. Some of those are about surveys in particular or CAHPS principles in general. If the FAQs don't answer your question, please do reach out to the team. We're happy to help with any questions about development, testing, and administration of CAHPS surveys. Next slide, please. Dale, I'm going to turn it back to you to kick us into our Q&A.
Okay. Thank you, Stephanie, and thank you, Julie, and thank you, Aruna. Invite all three of you, Stephanie, to stay on, and Aruna and Julie. There you go. That was a really great review of foundational principles of the CAHPS program, what's brand new in development among CAHPS surveys, what's currently available now, and the tools and resources. So that was excellent. We have a number of questions that have come through, and I'm going to start with one, basically, Stephanie, that just follows up on where you were describing the new outpatient mental health survey, wanting clarification that the ECHO survey is actually now being replaced by the new outpatient mental health survey.
We have lots of users who want to do lots of different things. And so the ECHO survey is still alive and well on the AHRQ CAHPS web pages. So for users who, for whatever reason, want to continue to use that survey, maybe for trending or for other reasons, there's certainly no reason that you couldn't. However, we think that there are some kind of newer strategies and newer approaches to asking questions about behavioral health that are offered in the new survey. So we might encourage users of the ECHO survey to take a look and see where it might make sense to make a transition. In documentation that we are about to make available, we also have some suggestions and thoughts about incorporating items from the old ECHO survey into the new outpatient mental health survey, so we can help you to make that transition if it makes sense to you. So again, it's the flexible options of CAHPS, but yes, encourage you to look at the new one.
Thank you. That's very helpful. So Julie, there's a question came in early as you were talking about the surveys under development and the testing that goes into that process. The question is, if the testing is only conducted in English and Spanish, do we recommend that we only survey members in those two languages? How do you handle differences beyond English and Spanish?
That's a great question. Thank you to the submitter for that question. So AHRQ is able to maintain and provide Spanish language translations. As Stephanie has given us an overview, there are a lot, it's a big suite of surveys. So the consortium resources are able to provide Spanish translations of all surveys, but we recommend that survey sponsors and survey users conduct the survey in the languages that meet the needs of their survey populations. And to help with that, the consortium has published translation guidelines that sponsors and users can follow to produce a credible translation of the survey. There are also many existing translations available via specific websites that are supported by CMS, such as for HCAHPS, the hospital survey, the hospice survey, the health plan survey under the Medicare Advantage CAHPS program. There are multiple surveys out there, multiple websites out there that provide translations in many, many other languages. But we encourage the administration of the survey in all languages that meet your patient population needs.
Thank you, Julie. Stephanie, another question related to survey administration with respect to the new surveys that are available. Is it required or is it advisable that a user use an approved survey vendor to administer those surveys?
Thanks, Dale. So some of this is a distinction about how you're planning to use the survey. And there is no specific requirement from AHRQ that you must use an approved survey vendor. And in fact, there are not yet approved survey vendors for those surveys. Typically, when it's a CMS required implementation, there is a requirement to use a CAHPS survey vendor that is appropriate for that survey. So because these are not mandated by CMS at this time, I think there's some liberty to proceed in a way that makes sense. I will say that many of the vendors have good modalities and approaches and efficient ways to administer the surveys. And so you may want to consider what the benefits might be for your organization to use a survey vendor based on their skills and expertise, but that would be a choice.
Okay, great. Julie, there's a really interesting question that I was kind of anticipating might come in around the maternal health survey that you described. The question is, maternity patients are sampled for HCAHPS already. Do you anticipate, or can you speak for CMS, anticipating a future where those patients would receive the maternal health care survey instead? Is the new survey envisioned as a supplement to HCAHPS, two separate surveys? What can you tell us about how that might unfold in administration?
That's a great question. So a lot of this will hinge on field testing and what the final set of items emerges. So one possible path might be that the maternal health care survey questions become a supplemental item set that could be readily plugged into the traditional HCAHPS survey. Or another path that may emerge could be a standalone survey that is designed for patients whose primary discharge is labor and delivery. Now, how that gets managed in the context of the existing HCAHPS program will be up to CMS, but one option would be to integrate the survey into the HCAHPS program so that patients with labor and delivery discharges could receive the survey. Or many hospitals have a sufficient number of labor and delivery discharges to field the survey as a supplemental survey, as many hospitals currently do to assess ED care and other aspects of their inpatient care.
Great. A lot still to be determined, right?
For sure.
Stephanie, I want to come back to you. This is a question you were talking about the surveys that are part of the CAHPS databases. This relates to the HCBS survey and whether the questions are applicable to just adults or can they be used for children? And you might say something regarding a new pediatric version in development.
Thanks, Dale. Great question. And understanding that HCBS services cover adults and children, and a large volume of children within the HCBS services well understand the question. The current HCBS survey was developed and is intended for adult populations only. It was not designed or developed or tested for children. Understanding that leaves a gap in terms of understanding experience with HCBS for those who are children, youth, and young adults. CMS and AHRQ are partnering on looking at the feasibility and development for a child, youth, and young adult survey for HCBS. So stay tuned as next steps unfold for that.
Great. So Julie, I'm going to come back to you now. There's a couple of questions related to the health plan survey. The first part is just one of timing. Do you have any sort of projections for anticipated availability of the new CAHPS health plan survey and its release?
Sure. Well, there are still several steps that still need to occur, such as additional stakeholder input, and I believe I mentioned field testing. The goal of AHRQ and the consortium would be to release a survey in calendar year 2026. So keep watching for information and updates on the survey.
And then another question related to the health plan survey and the changes that potentially be making to the CG CAHPS survey comes from Nicole Cable. In terms of the domains, the measurement priorities, and experience reporting, is there any opportunity between those two ambulatory surveys to align insights or kind of streamline their implementation. Thoughts
So,
on that?
Nicole, you could have been a fly on the wall when we were having these discussions. A goal, one of there are, multiple goals of this effort, right? Which is to make sure the health plan survey still reflects the content that's important to patients, that is results in reliable measures and can inform quality improvement and quality measurement. But within that framework, an additional goal is to minimize overlap between clinician and group and health plan surveys, and to assure that there's not redundancy or needless redundancy between the two. And the health plan survey that emerges from this 6.0 development effort really focuses on critical functions and interactions with the health plan that really affect patients' experience with their ambulatory care.
Yeah, very good. Stehpanie, there's a question regarding kind of the resources and tools that are available for guidance for survey administration. The question has to do with fielding the CAHPS survey. Will there be guides for each service line, or it's clearly for each survey instrument? Can you just elaborate a little bit on what are the resources available on the CAHPS site for these new surveys or existing surveys for actual administration and fielding?
Absolutely. So we've been working on updating guidance documents overall to try and make the information most accessible to users and easier to find through a regular Google search and that sort of thing. So there's some guidance about CAHPS survey administration and kind of best practices that cuts across all the surveys. Some of those things might include formatting instructions for a paper survey, or approaches for web surveying and how you might want to do that in conjunction with non-response follow-up by mail or by telephone. So some of that cuts across all of the surveys and is provided in a more generic format on the CAHPS website. And then there are specific guidance documents for each of the surveys that, for example, provide information about how you may want to consider sampling, or how you would calculate a complete, or what the composites are and what questions are within them. And for those, they would be associated with each survey. And I will say that in our eagerness to make sure that we have surveys out as quickly as possible for users, sometimes the surveys go out first and the guidance documents follow soon thereafter. So if you're looking for something in particular for one of the new surveys, it may be on the coming soon banner, and please feel free to reach out to us through the CAHPS TA box, and we will get back to you and provide you whatever information we have. I will also note that for CMS administered surveys, we list all of the CAHPS surveys to make sure that they're in one place and people can find what they're looking for. But we will provide a link and redirect folks to CMS web pages for surveys where they have a national implementation, for example, for HCAHPS. And I know CMS is good about putting up updated information about their surveys, updating them annually, and any guidance documents they have around those. So in some cases, we'll redirect you to another place where they will have the latest and greatest information about fielding a particular CAHPS survey.
Perfect. Thank you. So Aruna, I'm going to bring you back into the conversation here a little bit and pose a question that gets to sort of the heart of the CAHPS sort of foundational principles that were reviewed at the top of the webcast. The question is that CAHPS are considered patient experience surveys, not patient satisfaction surveys. Can you elaborate a little bit more on what's the difference between an experience-based survey and a satisfaction survey?
Sure. So patient experience refers to what actually happened to a patient in a healthcare setting during a healthcare encounter, or whatever that was supposed to happen, how often did it happen? But when it comes to patient satisfaction, it measures how patients feel about their healthcare and whether their expectations were met from the healthcare encounter they had. So CAHPS surveys, they strictly measure healthcare experience.
Okay, great. Can I just ask you also, because so many of the questions that we get in our webcasts and online and in the field, just one more time clarify the difference between AHRQ and your role, our role as a research and development group versus CMS or NCQA in terms of their more regulatory or requirement roles?
Sure. So AHRQ is a research-based agency within the U.S. Department of Health and Human Services, and it is the lead federal agency that is responsible for improving the safety and quality of the U.S. Healthcare system. AHRQ typically generates research tools and data using best practices that healthcare providers and policymakers can use to improve the quality of healthcare delivered by delivered to patients. So since AHRQ is a research agency, AHRQ does not mandate the use of surveys or does not require submission of survey results to us. We only provide the tools. As Stephanie mentioned, they are free of charge. They're available on the website, and it's not a regulatory agency. CMS, on the other hand, does mandate the use of CAHPS surveys. There are various programs within CMS that require the use of the CAHPS surveys, and they are mandated.
Great. And when those mandates come out, the rules of how surveys are administered and what vendors and participating organizations need to do are set by CMS or other agencies outside of AHRQ. Thank you. I think that's always
correct.
A very helpful distinction to keep in mind as we go through what CAHPS does and how it affects health systems, patients, and providers. I do want to get back to you, Stehpanie. You talked about the outpatient mental health survey. There is a question about potential development or in-process development of an inpatient behavioral or inpatient psychiatric facility survey. Do you have any updates on that?
Yeah, we do. That is in progress and under development, and maybe not quite on the coming soon banner the way the other surveys that Julie talked about are. But some of you may have responded to a request for public comment. As Julie mentioned, we also conducted a literature review and have done substantial collection of input from stakeholders, and in fact developed a draft survey. So the next step would be field testing for that. Thank you, Julie, for setting the stage of what exactly all the steps are. So if you were following it like a process map, the next step for that survey would be field testing. We do not at this point have a set date for field testing, but we will certainly keep folks updated on development of that survey and when you may be able to expect to see it.
Great. And I want to come back again to you, Aruna, sort of in line with what we were talking about in terms of AHRQ and other organizations. Will everyone have access to the CAHPS surveys that have been described today or that are currently developed and available? I think the issue is what's in the public domain, and can you address that?
Yes. So all the CAHPS surveys that are discussed today will be available on the CAHPS website. As Julie mentioned, the health plan survey will be available in 2026, and every survey that is in development will be available on the CAHPS website.
And anybody can use them. The guidance is there. Whether it's required that you use a survey vendor that's been certified is another issue, but they are all of the tools, all the surveys are in the public domain and free of charge. Okay, we've gotten through quite a few questions. There are a few remaining in our time. I want to shift back to you, Julie. A question from Jim Schaefer. Have you considered offering a survey invitation via text? Kind of gets us into the mode options available, and what can you tell us about using text for invitations?
Sure. So there has been testing of invitations via SMS or text message for web-based surveys on multiple CAHPS effort. And some of that has available in published literature and on the AHRQ CAHPS bibliography. You can also find information on testing on CMS's ED CAHPS webpage. From my read of the literature, this approach meets with differing success depending upon population, and it hasn't been demonstrated as a method that works broadly for all patient populations. And for those of you who are familiar with the Telephone Consumer Protection Act, or TCPA, there are some challenges with the use of SMS messages and having permission to contact patients via SMS. Different organizations and different internal councils, interpret those guidelines differently. So each organization has to work with their compliance department to navigate that approach appropriately.
Very good. You mentioned just in passing the ED CAHPS survey. There's a question about if you have any information, Julie, on updates to the ED CAHPS or the pediatric CAHPS surveys. I'm not sure because most CAHPS surveys have both an adult and child version. I don't know if it's related to the child HCAHPS survey or which one, but at least comment on the ED CAHPS survey.
Sure. For the ED CAHPS survey, CMS does have an ED CAHPS webpage. And on that page, you'll find the survey. It's available for hospitals and emergency departments who wish to use it on a voluntary basis. At this time, it's not a mandated survey. Like those of you in attendance, I monitor CMS's CAHPS webpage and look for news updates. And I personally haven't seen anything indicated ED CAHPS will be mandated anytime soon. But, we should all continue to monitor for updates and information. I also interpret the question as asking about the child or pediatric HCAHPS survey, which asks about a child's inpatient experience. Similarly, I'm not aware of any effort on the part of CMS to require or mandate this survey. But again, the CMS CAHPS webpage continues to be a good source of information about CMS's current and future plans for CAHPS.
Right. I will also add, just in terms of the child HCAHPS survey, it currently is not mandated. I know the Leapfrog group does have an incentive for organizations that choose to participate in Leapfrog to implement and report their scores on that survey. And there is some discussion underway about revising the child HCAHPS survey. So stay tuned to that development process as it unfolds. Okay, let's see where we are. One of the major question areas and this is a big one, but Julie, I'm going to come back to you on this real quick. In the registration, we received a number of questions about strategies for increasing response rates. We don't have too much more time, but can you just sort of maybe highlight a few kind of tips for thinking about strategies for increasing response rates?
Sure. So I will be brief. I think making sure you have up-to-date and correct contact information for patients is critical. We're finding that many sponsors think they have accurate information while they don't. Can't stress enough the importance of administering the survey in more than one mode. Mixed mode surveys get higher response rates than single mode surveys. There's varied evidence out there, but some indication is that telephone is a great mode to partner with other modes in that it will capture those who are more likely to prefer the survey in another language, maybe more likely to have a chronic condition or be dually eligible. But I would say mixed mode administration, the accuracy of your contact information, and offering the survey in multiple languages, I think are important to contributing to improved response rates.
Great. Excellent summary of a very big topic that I know is very important to users of CAHPS surveys and other surveys. Hey, we're just close to time. I want to move on to just the wrap-up phase. I think we've addressed all the questions that have come in online. I hope I'm not missing any. Can we go to the next slide that talks about where you can get access to program updates from the CAHPS team? Right. So the CAHPS program periodically sends email updates through Gov Delivery. Anybody can subscribe to this, and the way to do that is to go to the AHRQ website, and you can find the email updates little icon in the upper right-hand corner. You select that, and then you have a whole menu of options. You can select multiple sources of information. We encourage you to select the CAHPS news and events. So you get periodic updates on webcasts like we're having today, other tools and resources that come out, new surveys, other educational resources. One thing I will tell you that is upcoming that you will, I think, be interested in is the annual CAHPS research meeting sponsored by AHRQ is now scheduled for September 18th. It'll be from 1 to 3 p.m. And the topic this year is elevating the role of patients and families in assessing and improving the experience of care. And I know this is going to be of interest to many organizations about the critical role of engaging patients, caregivers, families, and other stakeholders in this whole development process, and the use of the survey results in improvement activities. We have a really fantastic lineup of speakers underway. Stay tuned for information on that meeting and upcoming webcasts via the CAHPS Gov Delivery service through the email update function. I think if we can move to the next slide is basically ways in which you can stay in touch with the CAHPS program, either by email at CAHPS1@westat, WESTAT.com, COM. Our 1-800 phone number is 1-800-492-9261. And the website, which is full of information that we've reviewed today and more, various categories of surveys and administration and the CAHPS databases and other resources, are all at www.ahrq.gov/CAHPS/. Many ways to keep in touch with us. We hope you will do that. If you have questions that we didn't get to today, you can send them through email or through the 1-800 phone number. And I think with that, we might conclude just a couple of minutes early today. Thank you for your participation. Thank you again to Aruna and to Stehpanie and to Julie for wonderful presentations, and to all of you for your participation as well. Thank you, and have a great rest of your day and a great summer. We'll see you again soon.